Now, an Emeritus Newsbrief, I'm Lynn Houston. President Obama accelerates his campaign against what he calls misinformation and scare tactics. Today, he took his town hall to Portsmouth, New Hampshire.
Last question right here. This is a skeptic, right?
I am a skeptic.
Good.
Thank you, Mr. President, for coming to Portsmouth. My name is Michael Leon. I'm from Derry, New Hampshire, District 1 in the Congressional District. I'm one of the people that turned myself in on the White House webpage the other day for being a skeptic of this bill. I'm proud to have done so.
Before you answer this question, just because you referred to it, can I just say this is another example of how the media ends up just completely distorting what's taking place. What we've said is that if you get an email from somebody that says, for example, Obamacare is creating a death panel, forward us the email and we will answer the question that's raised in the email. Suddenly, on some of these news outlets, this is being portrayed as Obama collecting an enemies list. Now, come on, guys. Here I am trying to be responsive to questions that are being raised out there.
And appreciated.
And I just want to be clear that all we're trying to do is answer questions. All right, go ahead.
So my question is for you, and I know in the White House the stand which you're on has often been referred to as the bully pulpit. Why have you not used the bully pulpit to chastise Congress for having two systems of health care, one for all of us and one for them?
Well, look. First of all, if we don't have health care reform, the gap between what Congress gets and what ordinary Americans get will continue to be as wide as it is right now. And you are absolutely right. I don't think Carol or Paul would deny they've got a pretty good deal. They've got a pretty good deal. I mean, the fact is that they are part, by the way, I want you to know, though, their deal is no better than the janitor who cleans their offices, because they are part of a federal health care employee plan. It is a huge pool. So you've got millions of people who are part of the pool, which means they've got enormous leverage with the insurance companies, right? So they can negotiate the same way that a big Fortune 500 company can negotiate, and that drives down their costs. They get a better deal. Now what happens is those members of Congress, and when I was a senator, same situation, I could, at the beginning of the year, look at a menu of a variety of different health care options. Most of them offer, these are all private plans, or they could be non-for-profit, Blue Cross Blue Shield or Aetna or what have you. They would have these plans that were offered, and we would then select what plan worked best for us. But there were certain requirements. If you wanted to sell insurance to federal employees, there were certain things you had to do. You had to cover certain illnesses. You couldn't exclude for pre-existing conditions. I mean, there were a lot of rules that had been negotiated by the federal government for those workers. Now, guess what? That's exactly what we want to do with health care reform. We want to make sure that you are getting that same kind of option. That's what the health exchange is all about.
Meanwhile, the White House has put up a new website called Reality Check, a fact-checking outlet that takes on the latest rumors and charges from health reform opponents. Another report just released putting the numbers behind the people who are rejected or canceled by health insurance companies. The U.S. Department of Health and Human Services released the report, which shows that 12.6 million non-elderly adults, 36% of those who tried to purchase health insurance directly from an insurance company in the individual market, were in fact discriminated against by being rejected or canceled because of pre-existing conditions in the previous 3 years. 6% said they lost their coverage because they were diagnosed with cancer. The report can be seen on the Emeritus News insurance page. And a stinging assessment of those accused of distorting health care reform from MSNBC host Keith Olbermann, who blames much of the misinformation on zealots of lesser intelligence who are out to win some kind of game.
Because a percentage of America does not want explanations nor serious conversation. It wants panic and the guilty thrill of chaos and an excuse to bash skulls and hang people in effigy. or not in effigy. Ms. Palin, what in spirit is the difference between this monstrous image of a congressman hanged in effigy and the indefensible smile of pride on that idiot's face and this image, with not one murderer in the mob even feeling the need to hide his face for fear of justice that would never come? They are both, to use your phrase, death panels. Ms. Palin, you might as well have declared that the government is being run by a coven of witches with fake Kenyan birth certificates. And you might as well have told the vast, unthinking throng that mistakes your ability to wink for leadership that they should start shooting at Democrats. There'd be no need to tell them to bring the guns. Others have already done that. Somebody left his at an Arizona town hall.
See the rest of Olbermann's commentary on the Emeritus News Major Developments page. The Office of Inspector General at the Justice Department doesn't think much of the FBI's record-keeping on suspected terrorists. The IG's office says the FBI is sloppy with the list and that some people who should have been removed from that list run into problems such as not being able to get a visa or a passport. More on that story on the Emeritus News National World page. The American Civil Liberties Union says disabled students get a disproportionate share of corporal punishment in schools. The group says it's just another reason why corporal punishment in schools should be banned. More on the Emeritus News Education page. The latest on the biggest issues in public policy at emeritusnews.com. And 24 hours, 7 days a week on the Emeritus News channel on livestream.com. That's an Emeritus News Brief. I'm Lynn Houston.